Hi everyone, Jennifer Blevins-Smith with Integral Clinic Solutions, and you're watching my YouTube channel, Navigating the Business of Medicine. Today I want to talk about EMR changes and how it can affect the bottom line. A lot of people don't think about this when they start thinking about all of the pieces that have to come together or need to be figured out before switching an electronic medical record or health record system. But honestly, one of the biggest effects that are negatively impacted, I should say, of a business when you change an EMR, EHR system are your finances for at least the first 3 months. Changing over systems usually includes changing over something that affects the revenue cycle, whether it is registration, it's interoperability or interchanges when it comes to like clearinghouses. Maybe it's the entire billing system, the whole management billing system gets changed over. But nonetheless, anytime you change over an EMR, EHR system, there is going to be some revenue loss and or delay. People do not anticipate this, and it becomes very stressful after the new system is implemented because for at least the first 3 months, usually there is a decrease in finances, and that either could be a permanent loss for those 3 months or it's just a very long delay in getting that money, and people haven't saved up or anticipated this in their budgeting, and it becomes very tight and people become emotional and not logical, and it's just not good for anybody. People do not realize this. They think about the interruption to patient care and operations within the business and just workflows and people having to learn a new system and the transition from one system to the other and how you might need to work out of the old system for a while and in the new system at the same time, simultaneously. But a lot of people don't think about the part that you don't sometimes have the physical hands on until you see it not showing up in your bank account and you're trying to pay bills and you're noticing, oh my gosh, where is the money I'm used to during this time of the month or this time of the year, because it's not there. Also, a lot of people like to switch systems at the end of one year and the beginning of another year, which I understand the logic behind that as well, because you're like, okay, it'll make it easy to remember that we stopped using this system in this year and we started the new system at the beginning of this year. And that does make sense. But if you look at it from a medical billing point of view or a revenue cycle manager's point of view, which is where I'm coming from, the beginning of the year is deductible season. So you're already starting off on kind of a handicap with your billing at the beginning of the year, especially depending on your specialty and your volume of patients and how many providers you have in your practice. But then you add the changeover on top of it, and it could be very difficult for your finances, especially if you didn't anticipate the changeover deficit on top of the deductible season. We all know deductible season relies on patients to pay their bills because most of the money coming in will be patient responsibility until they hit these deductible amounts. And if you don't have patients paying their bills, and then you have already a delay in finances because of a changeover and claims not going out as fast as they normally would, and maybe patients aren't getting their bills as fast as they normally would to be able to pay. I mean, there's just so much there. It's just not a good idea. I would encourage at least if you're going to switch over systems to try to do it June 1st or do it October 1st, because at least then hopefully you've had at least 6 months of building up your bank account, unless of course you've budgeted for it, you have a nice little fluff in your account to anticipate for this, that's totally different. But I still would encourage not the very beginning of the first of the year, maybe at least the second quarter if you have anticipated, just to be on the safe side. But if you wait until the third or fourth quarter, at least, you would maybe be able to get that money in, feel comfortable if you're having delayed payments or no payments coming in or whatever it is, and you feel solid because you have payments coming from insurances. So once they do pay, you know it's coming. It's not coming from patients, reliability and responsibility and all of that. And it's just in a better situation. So this video is just a high-level overview. I just want to bring it to your attention that sometimes when you start a practice, you think that you went with the best EMR, EHR system for you, but you start utilizing it in the capacity in which you see patients, in which you operate, and you realize, it's not really what I wanted or what I was hoping for, so you shop around. You find something else that is better, and now that you're more knowledgeable and hands-on, it makes more sense, and you want to switch over. Anticipate with your budget because of the loss of finances. It happens to everybody. It just does, even if you do the best of planning. And also, don't do it at the first of the year if you can help it because of the deductible season factor. You're just kind of adding salt in a wound. So again, just bringing awareness, keep this in mind. It's okay to switch systems. I encourage people to try not to switch systems too often, or to pick one. If it doesn't work, then pick your final one for the course of your practice and organization, because it's costly, even out of pocket, and the time it takes to train staff and all of those other factors. So it's not something that should be done very often or frequently, but you should have intentions to whatever you choose you're keeping for a long while at least, and then anticipate all of these other financial impacts that can happen. If you have any questions or comments about that, please leave that in the comments below. Smash the thumbs up button if today's video was helpful. Subscribe to my channel if you haven't already, and please share this video with your colleagues, because I think this is something that a lot of providers, private practice owners will benefit from. I appreciate the support. We'll see you next time. Bye-bye.